This is a Red FM Vancouver podcast. Make sure you hit subscribe for more great content. For further info, log on to redfm.ca.
ਇਹ 16 ਮਾਰਚ ਦੀ ਗੱਲ ਹੋਵੇਗੀ। 15-16 ਮਾਰਚ ਨੂੰ ਜਦੋਂ ਇਹ ਬਿਮਾਰਾ ਫੈਲਣ ਲੱਗਾ ਤੇ ਇਸ ਮਹਾਮਾਰੀ ਦੇ ਵਿੱਚ, ਇਸ ਪੈਂਡੈਮਿਕ ਦੇ ਵਿੱਚ USA ਨੂੰ ਜਾਣ ਵਾਲੇ ਟਰੱਕਰਸ ਨੇ ਜਿਹੜੇ, ਉਹਨਾਂ ਨੂੰ ਅਸੈਂਸ਼ੀਅਲ ਸਰਵਿਸਿਜ਼ ਕਰਾਰ ਦੇ ਦਿੱਤਾ ਗਿਆ ਅਤੇ ਟਰੱਕਾਂ ਵਾਲਿਆਂ ਦਾ ਆਉਣਾ ਜਾਣਾ ਚਾਲੂ ਰਿਹਾ। ਹੁਣ ਕਿਉਂਕਿ ਅਮਰੀਕਾ ਦੇ ਵਿੱਚ ਇਹ ਮਹਾਮਾਰੀ ਬਹੁਤ ਜ਼ਿਆਦਾ ਫੈਲੀ ਹੈ, ਜਿਹੜੇ ਮੈਂਬਰ ਪਾਰਲੀਮੈਂਟ ਨੇ, ਬਹੁਤ ਹੀ ਸਤਿਕਾਰਯੋਗ ਡੌਨ ਡੇਵਿਸ, ਔਰ ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਹੁਣ ਇਹਨਾਂ ਟਰੱਕਰਸ ਦੇ ਜਿਹੜੇ ਟੈਸਟ ਹੈ ਉਹ ਲਗਾਤਾਰ ਹੋਣੇ ਚਾਹੀਦੇ ਨੇ। ਉਹ ਕਿੰਗਸਵੇ ਦੇ ਮੈਂਬਰ ਪਾਰਲੀਮੈਂਟ ਹਨ ਅਤੇ ਫੈਡਰਲ NDP ਦੇ ਹੈਲਥ ਕ੍ਰਿਟਿਕ ਨੇ ਅਤੇ ਸ਼ੈਡੋ ਕੈਬਨਿਟ ਦੇ ਵਿੱਚ ਇਹਨਾਂ ਦੀ ਬੜੀ ਅੱਛੀ ਪੋਜੀਸ਼ਨ ਹੈ। ਉਹ ਕਹਿੰਦੇ ਲੌਂਗ ਹਾਲ ਟਰੱਕਰਸ ਨੇ ਜਿਹੜੇ USA ਨੂੰ ਜਾਂਦੇ ਆ, ਇਹਨਾਂ ਦਾ ਪੂਰੀ ਤਰ੍ਹਾਂ ਟੈਸਟ ਹੋਣਾ ਚਾਹੀਦਾ। ਪਬਲਿਕ ਹੈਲਥ ਏਜੰਸੀ ਆਫ ਕੈਨੇਡਾ ਇਨਫੋਰਮੇਸ਼ਨ ਇਕੱਠੀ ਕਰੇ, ਲੌਂਗ ਹਾਲ ਟਰੱਕਰਸ ਦਾ ਇੱਕ ਡਾਟਾ ਬਾਕਾਇਦਾ ਤੌਰ 'ਤੇ ਰੱਖਿਆ ਜਾਏ। ਟਰੱਕਰਸ ਜਿਹੜੇ ਮੈਨੀਟੋਬਾ ਦੇ ਵਿੱਚ ਨੇ, ਉਹਨਾਂ ਦੇ ਕੁਝ ਕੇਸਿਸ ਸਾਹਮਣੇ ਆਏ ਨੇ, ਉਹ ਲੌਂਗ ਹਾਲ ਟਰੱਕਰ ਸਨ ਅਤੇ ਇਸੇ ਤਰੀਕੇ ਨਾਲ 10 ਕੇਸਿਸ ਤਕਰੀਬਨ ਪਿਛਲੇ ਮਹੀਨੇ ਇਹ ਟਰੱਕਿੰਗ ਕੰਪਨੀਜ਼ ਦੇ ਨਾਲ, ਟਰੱਕ ਡਰਾਈਵਰਸ ਦੇ ਨਾਲ ਮੈਨੀਟੋਬਾ ਦੇ ਵਿੱਚ ਡਿਟੈਕਟ ਕੀਤੇ ਗਏ ਸਨ। ਸਤਿਕਾਰਯੋਗ ਮੈਂਬਰ ਪਾਰਲੀਮੈਂਟ ਡੌਨ ਡੇਵਿਸ ਮੇਰੇ ਨਾਲ ਹਨ। Mr. Davies, good morning.
Good morning.
Thank you very much for joining us today.
It's my pleasure.
So can you tell us exactly your concern is about the testing of truck drivers?
Yes, I can. And it's not testing, it's about information and data collection. So my main concern is we found out that the Public Health Agency of Canada, in fact, no federal agency, CBSA or any federal agency, is tracking COVID-19 exposures among truckers who are traveling between the US and Canada. So they're not gathering any information at all, and I think there should be.
Mm-hmm. But I think that is a provincial jurisdiction. If the provincial health authorities do not want to share that data with the federal authorities, it's up to them, isn't it?
Well, you're right. And that's been a problem that has been exposed at the Health Committee back since March. Every expert and researcher in Canada has been telling us that we do a very poor job in Canada of sharing information between the provinces and the national government. Now, the real problem, though, is that the provinces aren't gathering this information either. So nobody's gathering it. So, you look at the United States, it has the highest number of COVID-19 cases in the world, with 2 million cases, and there's been a recent spike, an increase in cases in Washington State, in Oregon, in California, in Arizona. So here we're sending our truckers into some of the most dangerous area of the world in terms of COVID-19 exposure, and we're not protecting them. We're not even gathering information about where they're going or what their exposures are, and without that information, we can't develop proper testing and contact tracing protocols, which we're told we must do in order to get on top of this virus.
Mm-hmm. Mr. Davies, why do you think it's imperative that these truckers are tested on a regular basis and the database maintained?
Well, I think first of all, it's for the protection of truckers and their families and their communities. Is first of all, truckers need to have access to information. Now, there's big differences here. A driver here in Vancouver who's going down on a day trip to Seattle and back at night is in a very different situation than, say, someone in Ontario who's driving through New York and then down to Georgia for a 5-day trip. Their exposure patterns and frequency and seriousness is different. So I think we should be at the border asking truck drivers where they've been and what they're doing, so that we can gather a profile, and then we can properly inform drivers, and then perhaps we can have testing protocols where it's necessary, where we think that those truckers may have been put at risk. So this is just what epidemiologists, infection experts are telling us we have to do in order to have a very good idea of where the exposure threats are so that we can get in front of it and not wait until there's an outbreak.
But some of your critics are saying, I've heard that they're telling that your statements are creating discrimination against long-haul truckers. What's your take on it?
Oh, absolutely not. I'm motivated by protection of long-haul truck drivers. You'll remember at the beginning of the COVID-19 outbreak, we were sending truckers into the U.S. without proper protective personal equipment, without making sure they had access to sanitary washrooms and restaurants. And here, these are the bravest workers we have. These are essential workers that we were sending into Washington State at the time, very dangerous area. And they were, with their courage, they were keeping our economy and our communities running. So this is all about not waiting until those truckers get exposed, but actually giving them the most up-to-date information they can have to protect them. If you look at the long-term care centers or the meatpacking industry or the prisons, where we have had outbreaks in COVID-19, we waited until the outbreak happened, then we responded. I don't want to put our truckers at risk. I think that we should be gathering information now so that they have the best information they have. And then we can, have testing and tracing protocols that work and make sense for the truckers depending where they're going. So it's all about protection of truck drivers.
And what solutions do you propose to make testing easier and more accessible for truck drivers?
Well, first of all, we start with information. I think that at the border, CBSA, there should be some basic questions and data collection of drivers. Where have they been? How long have they been in the States? Some questions, were they exposed to other people? Did they have to use washrooms? Where did they eat? There should be some basic questions developed, and not on a particular driver, so that we can gather this information on a general in a general way. And then what we can do is we can craft appropriate testing if that's needed. We don't want to just be testing everybody. That's not necessary, and we don't need to. But what we do need to do...
Oh, you're suggesting random testing? Like drive-through testing?
No. Well, that's... a drive-through process is not necessarily a bad thing if it's very efficient. But I'm talking about targeted testing. What we're told is that we don't have one pandemic in Canada. We have a series of local pandemics. So in order to target exactly where the risks are, we have to have information. If you have no information, you can't test and track accurately. It's as simple as that.
My last question is, Mr. Davies, what do you think about this opening the border? On 21st of this month, I think borders can be opened because the President Trump is putting a lot of pressure on Justin Trudeau. And they're already relaxed the incoming of some PRs and Canadian citizens into Canada from United States. You think the border should open?
Well, first of all, I'm concerned about it. And number two, I think any decision about opening the U.S. border has to be done in a very cautious way that's based on science. I think what we've been doing is extending the border closure on a month-to-month basis. So the most recent agreement ends on June 21st. So I think we have to have a really accurate idea of what the situation is then. I am concerned, as I said earlier, that there's been a recent spike in cases in Washington State and Oregon and California. Mm-hmm. So, if their cases are going up there, that doesn't tell me that it would be wise to open the border up too much. On the other hand, I think there is maybe an argument that relaxing the border for family visitations may be in order. But again, if we go back to information, if we know exactly what's happening at the border, who's going and what the rate of transmission is, that will give us the information we need to make an intelligent decision. Mm-hmm. We haven't actually had, I don't think, very many COVID infections coming through the trucking industry. I think there's been an outbreak in Manitoba, but it's largely been quite good. But I want to keep it that way.
Anything you'd like to say in closing? You want to add something that I didn't ask you?
Yes, I want to thank all the truckers and their families for their essential work and for their courage. Keeping our economy going, they deserve our deepest appreciation and our protection. So that's what I want to say.
Mr. Davies, thank you very much for your time this morning.
It's my pleasure. Thanks again.
Thank you for listening to another Red FM podcast. Don't forget to hit subscribe and check out our Red FM Canada YouTube channel. For further info, log on to our Red FM social media platforms or visit redfm.ca.
Red FM